It is Heart Month, so it's appropriate. We have a expert cardiology services in the Northwest region of the Newcastle area. Dr. Paul Wawrzynski is also with us on our streaming, so you can see the good doc on the radio at kdkradio.com, presented by Metropolitan Window Company. Doctor, good morning.
Good morning. Thank you for having me. It's a pleasure to be here.
One of the things I think people get concerned about in this day and age is, am I going to be able to see my doctor, when there are changes in health systems around the region? And that relationship, the doctor-patient relationship, is so important, especially relating to cardiology. Why?
Well, I'm going to start out. I'll answer the latter part of the question first. When it comes down to cardiovascular disease, we know it's the number one killer in the United States. And although it affects individuals of all ages, it's clearly a predominance toward the middle and the elderly. Oftentimes, those individuals will have comorbid disease processes. So I think it's important that you have a physician that can quarterback all those problems together to be sure that there's no interaction or contraindication to any medications that you're on, testing that you may be having, or procedures being performed. Now, when it comes down to the doctor-patient relationship, I'm going to use the words of Sir William Osler, who is considered one of the founding fathers of modern medicine in North America. And he said it best: as human beings, we are all unique individuals. If the human body were like a machine, then medicine would be a pure science. We know that medicine is both a science and an art. So I think it's imperative that your physician apply the science of medicine to you as a unique individual, so that as a patient, you're getting the best possible outcome for yourself. And the way that is best performed is when you have a good relationship with your physician.
Makes a lot of sense, Doctor. And from a practical standpoint, since you mentioned the severity that heart disease presents and challenges for everybody in this country, when should we seek out care from a cardiologist? What would present itself for us to think, I've really got to get myself checked?
That's a great question. Certainly, any symptoms of any chest pain, and it may not actually be described or felt as a pain. It may be an unusual symptom like a pressure, a heaviness, or tightness in the chest, the upper shoulder, back region, particularly if it's associated with any shortness of breath or inappropriately sweating, or a feeling like a fluttering or butterfly feeling in your chest, or any symptoms of any inappropriate lightheadedness or passing out, should be evaluated by a physician.
What types of testing are available to determine the severity or presence of a heart condition?
That's in the year 2025, there are many tests available. There's non-invasive testing, such as an EKG that can look at the electrical activity of the heart, an echocardiogram, which is a sonogram of the heart that can look at heart function or problems with the valve. We have stress tests that can assess blood flow to the heart. We now actually have coronary CTAs, which are special CAT scans of the heart that can look at the coronary arteries to see if there's any blockage. And we still have invasive tests such as heart catheterizations, which is sort of the gold standard to assess for any blockage of the heart.
We're with Dr. Paul Wawrzynski, cardiologist with Independence Health System. So what are the general guidelines for individuals to follow, to things that we can control to help decrease our risks?
Sure. Excellent question. I always tell patients to try to stay as active as you can. If possible, try to exercise at least 3 to 4 times per week. Follow a good diet. The best diet out there is probably the Mediterranean diet. It's something your readers can Google. It's high in fruits, vegetables, and fish. We tell people to obviously avoid tobacco use. And then if you have any major risk factor for heart disease, such as diabetes, high blood pressure, be sure that you're seeing a physician to make sure that those problems are under good control.
And doctor, any additional things you'd like to add? Just because you have a audience here, you say, if I get the chance, I want to tell people this.
I always tell people cardiovascular disease can be a very unpredictable problem, just like the weather in Western Pennsylvania. So you may be having a great day, but if you have a day that you're not feeling well, have a low threshold to see your physician or care provider.
Well, we appreciate the work and your staff do every day, Doctor. Thanks for the time this morning.
Thank you. Thank you for having me. Appreciate it.
You got it. Dr. Paul Wawrzynski, cardiologist, the cardiology services at Northwest Regional Cardiology in the Newcastle area, part of Independence Health System Expert Care.